known as COVAL, and the Global Women's Institute at George Washington University's Empowered Aid Team. And we refer to the Global Women's Institute as GWI. So we're really excited to have you here to learn about working to end sexual exploitation, abuse, and the economic exclusion of women and girls. And this is sharing work that COVAL has been engaged in and GWI has been engaged in Kenya and other parts of East Africa. So as we get started today, I just wanted to do a little bit of, letting us get to know each other. So if you could introduce yourselves in the chat, it's always great to see who's on the webinar. We have a lot to learn, I'm sure, from each other. And if you can, let us know. We're recording the webinar for those who can't join live and would like to watch afterwards. So, if you're uncomfortable with that, just message me or one of the other panelists and let us know. And as you can see, we have this kind of webinar format. So we'll be taking questions at the end. And we welcome questions from the audience anytime during the presentation, and we'll be addressing those at the end. So without further ado, I will start off by introducing our first speaker. So to open the webinar for us, we're very, very happy to welcome Dr. Fatima Ali. Dr. Fatima Ahmed Ali is an associate professor of international relations at the School of Humanities and Social Sciences of the U.S. International University, Africa in Nairobi, Kenya. She's a visiting faculty and external researcher of the Inter-University Institute for Social Development and Peace of the Universitat Jaime I in Castellón, Spain, and she is the board chair of the Coalition on Violence Against Women, or COVAL. Dr. Ali holds a European doctorate with distinction in Peace, Conflict, and Democracy Studies and an international MA in Peace, Conflict, and Development Studies from Universitat Jaime I in Castellón, Spain. And she has a Bachelor of Arts degree in International Relations with honors, with minors in Sociology and Management from the U.S. International University in Africa. So without further ado, I will hand over to our distinguished speaker, Dr. Fatima Ali. And Dr. Ali, please remember to, yes, exactly.
Yes, thank you. Thank you very much, and good afternoon from Nairobi. I think it's good morning and everywhere you are. Good morning, good afternoon, good evening, and good night. Probably it's night. Thank you very much, Alina, for those kind introduction. On behalf of COVAL, I would like to welcome you to this webinar, which is very relevant. And today we are very delighted to discuss these issues and to not only share outcome of research that has been conducted in this area, but also we really want to unpack issues of sexual exploitation, especially among marginalized women, whether we're talking about urban refugees or refugees in the refugee camp. I think also it's critical to raise voice and to raise awareness on this issue. And I'm glad that a lot of people are joining us this afternoon and are looking forward to hearing the feedback and the findings of the research conducted. So I welcome you once again, and I hope that you will be able to give us feedback and that we will be able to learn also from also the participants who are learning. So on behalf of COVAL, I would like to flag and highlight that we've been working not with the urban, not with refugees, but the study we have conducted also kind of like connects to the study that has been conducted by the colleagues from the Global Women's Institute. And there is a lot of lessons to learn, and there's some things that we have learned that has been very interesting, especially when it comes to issues of economical marginalization. You know, how it links or connects to issues of sexual exploitation, and not only that, but also cultural marginalization that actually leads to economical marginalization. So I don't really want to unpack the whole presentation because I'm sure Hope and Frida will do that. So welcome once again, and I look forward to hearing feedback from the rest of the participants. Over to you, Alina. Thank you.
Thank you, Dr. Ali, for setting the stage. And this webinar really is about learning from each other. COVAL has an immense amount of expertise and experience in the areas of violence against women. So we're really grateful to partner with them on Empowered Aid and to have them as a member of our technical advisory group globally. And the work that we'll be sharing, while not, these are aligned projects, they're speaking to connected areas. So we really are excited to feature how we learn from each other, how we've learned within each piece of work, and kind of have a conversation around, the bigger picture and what this means. So without further ado, I will introduce my colleague, Hope Harriet, on the Empowered Aid Project. Hope is a research consultant with the Global Women's Institute on Empowered Aid, which she has led in Uganda and Kenya, and supporting international and local organizations in East Africa more widely for the past several years. She's a social worker by profession and a proud feminist. She has over 10 years experience in violence against women in both prevention and response, with a passion for research in the same field. So without further ado, Hope, we'll hear from you.
Thank you so much, Alina. Hi, everyone, and you're welcome to this webinar. I'll start off by sharing a little bit about Empowered Aid. Thank you, Amal. Empowered Aid is a project under the Global Women's Institute in George Washington University. GWI focuses on research on violence against women and girls, gender equality, using rigorous participatory research methods to creating a knowledge base which informs programming in humanitarian and development contexts. We are all aware that meaningful progress has been made in addressing sexual exploitation and abuse in humanitarian settings since its magnitude first came to light in 2002, but also remain cognizant of the fact that so much more needs to be done. Efforts to mitigate SCA risks require better engaging with local communities and understanding from them how aid actors can improve their programming and reduce the risk associated with sexual exploitation and abuse. So when I say SCA, I mean sexual exploitation and abuse. Empowered Aid provided rigorous participatory research on the ways in which aid distributions can increase sexual exploitation and abuse risks and how to better mitigate them. We do this in partnership with refugee women and girls in their communities and different organizations as well. The objective of Empowered Aid is to see how we can mitigate SCA risks through the creation or adaptation of aid delivery models that we have seen actively worked and also work to reduce the power disparities that exist between, for example, aid agencies and the beneficiaries. While we do this, we ensure that women and girls' voices are sustained and are centered in how aid is delivered. We use different participatory methods because we believe that the women and girls are the contextual experts of the risks that they experience, but also have ideas in terms of the risk mitigation measures that can be put in place. Next slide, please. So Empowered Aid recognizes the importance of contextualization when scaling up and working in new contexts, and continuing to engage refugee women and girls throughout the project. So right from the onset, project design throughout the implementation of the project. We also do this by ensuring that we share power with them and giving them a voice to ensure that Empowered Aid recommendations are grounded in their priorities. We have developed a contextualization toolkit that helps different partners adapt the findings that we initially got from the research that we did in Uganda and Lebanon, using different participatory methods so that they can contextualize that within their context, to engage women and girls to understand what the risks are that are associated with sexual exploitation and abuse, as well as coming up with recommendations and prioritizing them in terms of what can be done in order to make aid distribution safer. So right now I'm going to focus in on our work in Kenya. Amal, next slide, please. The Global Women's Institute partnered with World Vision Kenya to implement the Empowered Aid project in Kakuma and Dadaab settlements. Through the contextualization process, we engaged a total of 120 participants. 60 participants, we engaged them in contextualization workshops. So we engaged women and girls in Kakuma and Dadaab, 30 from each location, to understand the different risks that they face in terms of when they're trying to access aid in relation to sexual exploitation and abuse. But also we had participatory group discussions both in Kakuma and Dadaab, and engaged 60 participants, that is men and boys, in these conversations. Next slide, please. So based on the workshops that we had and the participatory group discussions that we had, these were the common risks that were identified across both locations. In the picture there, you can see an example of a community map from the contextualization workshop that we conducted with the women and girls in Dadaab. The women and girls in both locations mentioned that there are forests in the settlements, which pose a risk of them being raped, robbed, or experiencing also a physical violence. Of course, forests are not manned by security personnel. That means that the women and girls are left on their own to make sure that they safely pass through those places. The women and girls in Kakuma specifically mentioned that there's a seasonal river which they have to cross, and there's a high risk of them being raped, or their food items or them are being robbed. We also learned that sexual exploitation and abuse continues to manifest in different ways within the distribution or service provision during service provision. For example, some aid workers giving priority to beneficiaries to make them avoid making long queues in exchange for sexual favors. We also learned that there are teachers who promise girls marks in exchange for sexual favors. We learned that, for example, some aid workers direct women and girls to private chemists so that they can buy medicine prescribed to them at a higher cost, and yet they cannot afford it. That definitely increases their vulnerability. The other risk that we saw is sexual harassment in the terms that, for example, in Kakuma, there were no sex segregated lines. So the men rub themselves against the women, which makes them feel uncomfortable. They are inappropriately touched, which makes them feel uncomfortable and get out of the line, therefore making them to stay at the distribution point longer. There was also harassment by security personnel in order to, for the women and girls to enter the distribution points. There was harassment in terms of throwing words at them, or also physical assault, pushing the beneficiaries. Next slide, please. So on this screen, we have so many good quotes that came out of the conversations that we had with the women and girls in Kakuma and Dadaab. But on this screen, you can see, I will just pull out one that I will focus on. For example, one South Sudanese woman in Kakuma mentioned that, I went to the hospital with back pain, and the medic told me to wait outside. Later, when he summoned me into his office, he asked whether I have a husband or if I live with him. When I told him I do not stay with my husband, he said, I am not sick, I'm just sex-starved, and he can help me overcome that back pain if I accept to have sex with him. So this is just this is just an example of the manifestation of sexual exploitation and abuse, not just within food distribution, but also in other areas of service provision, or in terms when women and girls are trying to access different forms of aid. Next slide, please. The women and girls came up with so many recommendations, like I shared earlier on, because we recognize that they are the contextual experts in terms of the possible risk mitigation measures that we can put in place to help them feel safer when they're accessing aid. There were so many, but we had to prioritize. So in partnership with World Vision, these were the recommendations that World Vision was able to implement during the time of the implementation of the Empowered Aid Project. In Kakuma, they implemented separate lines and corridors during food distribution. As I earlier mentioned, they were not segregating lines. The men and women were standing in the same queue. There was increased awareness in both locations on sexual exploitation and abuse. Specifically in Kakuma, there was training of security personnel, including police, on GBV SCA, gender-based violence and sexual exploitation and abuse, and handling of persons of concern. In Dadaab, they were already implementing sex-segregated lines. So what the team went ahead to do was to implement sex-segregated corridors, because once the beneficiaries entered the lab groups, then they were mixed up. So they segregated the corridors where the beneficiaries would access their food from. I'm going to specifically focus on the DAB findings because we did the findings on from both locations are quite many. So we're just focusing in on the DAB. This is the contextualization process that we did, but also we proactively adapted World Vision tools to monitor the risks of sexual exploitation and abuse. I've already talked about the contextualization process that we undertook. We did on-site distribution monitoring, where we administered one safety audit in Daghali and Ifo. We did post-distribution monitoring, where we administered household survey. We administered a household survey at baseline. That was before we implemented any of the recommendations that came out of the contextualization workshop. So we spoke to 437 respondents. Then after the adapted distribution is when we implemented the recommendations that came out of the workshops, that we spoke to 437 respondents. So you can see the sex breakdown on the screen. Next slide, please. So I'm going to go into the results of the household survey. If you could go into the next slide. So this data is from both the baseline and the endline that provides the demographic information about the respondents that undertook the survey. In our sampling size, you'll notice that increased overall from the adapted distribution from 437 to 483. This was due to the population increase between the 2 points of data collection. Hence, we needed to increase on the number of respondents. When you see on the screen, you have more females who are interviewed because it's the women that mostly go for food, to collect food from the distribution point. The age of the respondents, the biggest category of respondents was falling between the ages of 39 and 58, and the age of 69 had the least number of respondents. This is because the elderly stay with extended families, so they have people to get for them food, and there are mechanisms to support them with getting food. The biggest percentage of our respondents were married, but also the biggest family size was 6 to 10. Next slide, please. So on this slide, we can see we also further went to understand if the households have persons with disabilities in them, to further inform programming. So we see that at baseline, 7% of the respondents mentioned that they had a child who has a disability, while 3% did mention that they had an adult with a disability. With adapted distribution, the percentage of households with the child with disability went down to 6%, and then it increased to 4% for the respondents who said they had at least an adult with a disability within their household. Next slide, please. So we asked respondents about the feelings of safety across the distribution process, and this is the snapshot. We see that the feelings of safety at baseline were at 70%. On the slides, you can see the sex breakdown. 31% of those were males, while 39% were females who reported feeling safe. With adapted distribution, this number increased from 70% to 83% of the respondents who've mentioned that they were feeling safe with the distribution process. The overall feelings of safety we can see increased for females throughout compared to male respondents. Next slide, please. So I'd like just to take a minute for us to focus on this slide. Empowered Aid looks at the distribution process as not just at the point of distribution. We want to understand the feelings of safety right from the way the beneficiaries receive or access information regarding how, related to food distribution, when they're traveling to and from the food distribution, during registration, at the distribution point, but also when they're storing the food. So on the screen, you can see the different data points that we checked in to see the feelings of safety for the beneficiaries. You can see that the feelings of safety improved with adapted distribution. For example, when accessing information related to distribution, it was only at 50% with the baseline, but after the adapted distribution, the number of those who felt safer went to 78%. When we come to specifically at the distribution point, it was at 62% at the baseline before we implemented the recommendation. After implementing the recommendation, the number of those who felt safe at the distribution point went to 72%. Next slide, please. We asked respondents if they had witnessed or observed any form of abuse from an NGO staff at the distribution point, both at the baseline and with adapted distribution. You can see that the percentage of those who had witnessed an NGO, any form of abuse by an NGO went down from 9% to 3% with adapted distribution. 3%, for example, of those who said they had witnessed a form of abuse or of violence by an NGO staff had said that they saw physical abuse, because later on in the questionnaire, we go on to ask what forms of abuse they had witnessed the NGO staff undertaking. 3% did mention that was physical abuse. Others, for example, mentioned 0.7% mentioned they had witnessed sexual abuse. And during our data collection, of course, our research team goes with an updated referral pathway, and those who wanted to get support were provided information of where they can seek for support. And then we asked the respondents to share with us what they felt like the most helpful safety measures would be in terms of making them feel safer when they're accessing different forms of support. You can see on the screen, the most chosen safety measure was educating girls and women on incident reporting, which was at about 39%. This was followed by an increase in the number of female distribution volunteers, which was about 37%. So this graph really helps us reflect, for example, different aid actors in terms of what are the things that we can start off in terms of what are the small different measures we can put in place to help us think through in terms of improving the safety of women and girls while they're accessing different forms of aid. Next slide, please. So just quickly, I'm going to wrap up by sharing findings from our on-site distribution monitoring. In terms of Amal, next slide, please. Yeah, next slide. These are just the highlights. The detailed findings, we have them in different reports. These are just highlights. In terms of safety, the staff that were on site had received training on GBV-SCA, but also they were seen to be proactive in terms of undertaking measures to make sure that the risk of sexual exploitation and abuse is minimized. We saw that 42 crowd controllers were involved in the distribution. Of these, only 11 were females. So 6 were at IFO and 5 were at Dakale. And there were no female police officers at any of the distribution sites. We also learned that both locations had clear methods of handling complaints, and there were community help desks also, which were manned by staff, both female and male staff. In terms of dignity, we can quickly see there were functioning hand washing facilities, but also important to note that there were clearly marked sex-segregated toilets. Despite the fact that we had sex-segregated toilets, the toilets were not lockable. So this is a very big protection concern at the distribution point. We also learned that there was no space for lactating mothers. Both locations had clearly sex-segregated access points, but also they were well-defined and clean. Then finally, so I've shared a lot of findings. Maybe the key takeaways from here, we have so many more of these. One is continue with sessions for community sensitization on GBV, but also communicate to the beneficiary in terms of where they can report SCA in ways that are accessible for them and also in languages that they can understand. It's important to segregate the corridors and also the lines for the beneficiaries when they're accessing food. Also provide childcare mother corners or lactating corners, breastfeeding corners. It's important to improve the number of female staff at the FTPs to ensure a higher number of females involved in different roles and positions as well. Holding perpetrators accountable is also very important in order to ensure the safety of women and girls. During the data collection, the perpetrators that were mostly mentioned were government security personnel, medical professionals, drivers, and aid workers. Thank you very much. I'll hand you back to Alina.
Thank you so much, Hope. I think this has been a fantastic presentation. Look at the approach of empowered aid, which is contextual safeguarding, so making the context safer and monitoring for risk, so that we can address those risks and reduce opportunities for perpetrators of violence to do so. And I'm really happy that we have Heather Cole in the chat, who's done a lot of work on contextual safeguarding and has been a great source of wisdom on that approach. So Heather, please feel free to chime in the chat too. So without further ado, I will introduce our final speaker. Last but definitely not least, Frida Wawira is a gender equity, safeguarding, and social inclusion specialist with 9 years of experience in program design, management, implementation, monitoring, and evaluation. She is currently working with COVAL as the programs manager and also serving as the acting executive director. Previously, she has worked with Plan International Kenya, Women Fighting AIDS in Kenya, and Gender Violence Recovery Center. And as mentioned, we're very happy to have her as a member of Empowered AIDS Global Technical Advisory Group as well. Frida, over to you.
Thank you so much, Alina. So I'll be speaking on our work, specifically our assessment on economic exclusion of women in the informal settlement of Nairobi. But before that, I would want to give you an overview of who we are. So Coalition on Violence Against Women is a national non-profit women's rights organization that was established in 1995. We exist to champion the rights of women and girls to be free from all forms of violence. And our vision is a society where women and girls enjoy equal rights, freedoms, and they thrive in safe spaces. So we are currently, next slide, please. We are currently finalizing our 2024-2028 strategic plan that focuses on 4 thematic areas, but I'll be briefly discussing about them. The first thematic area that we focus on as an organization is mitigation, responding to, and prevention of sexual and gender-based violence. And the purpose of this strategic area is to reduce the prevalence of sexual and gender-based violence and to improve the quality of life for survivors of SGBV, and also to enhance movement building, which is focused on ending harmful traditional practices. Our second strategic pillar is on access, enhancing access to comprehensive sexual and reproductive health rights services. And under this pillar, we focus on promoting bodily autonomy, emphasizing the importance of enabling women and girls to have the agency to make independent decisions regarding their sexual and reproductive health, and also promoting access to sexual reproductive health services such as post-abortion care. So our FGM work is under this thematic area, as well as the first thematic area. Next slide, please. Our third pillar is on access to justice, and under access to justice, we have broken it into 4 components. The first one being legal justice, and the focus here is to enhance access to justice for survivors of sexual and gender-based violence, and also strengthening the policy and the legal frameworks for women and girls in Kenya. So to mention is that we have a pro bono scheme of lawyers, and when we receive cases of SGBV, then we are able to provide pro bono legal aid services to the survivors of SGBV. And the pro bono legal aid services can include legal advice, court representation to the survivors of SGBV. And the second component is on climate justice. Under the access to justice, it's on climate justice. And here, COVAL seeks to advocate for climate justice as a mitigation for sexual and gender-based violence in marginalized communities. The third one is on economic justice, which is about where COVAL seeks to increase access to and control of economic resources by women and girls in Kenya. And finally, under access to justice, it's gender justice. And here we are working to enhance recognition and value of unpaid care work and also promoting the rights of childcare workers. And next, right, on the fourth strategic area that we focus on, it's on women's leadership and governance. And here we are working to increase women's occupation and meaningful participation in leadership and political processes. And here I must say that it's at all levels. We not only focus at women leaders who are at top political positions in the country, but also at women at grassroots level, including those ones occupying the positions such as the chief or the assistant chief or the elders, because they have an influencing role in mitigation, prevention, and response to sexual gender-based violence. So before I speak on about our study and give you highlight some of the findings, I want to take the next 30 seconds to just put on the chat box on which thoughts or words that come to you when you hear about using an intersectional approach. And the reason why I'm asking this is because we used an intersectional approach when we were conducting our study on economic exclusion of women and girls in business from the informal settlements. So I'm going to pause and then I will continue after 30 seconds. Please feel free to put on the chat box. We can look at that later. So to continue, next slide, please. So I'm going to give you an overview of our study on the barriers or challenges faced by women in their diversity when they try to operate business in the informal settlements of Nairobi County. So before we went out to do the study, we started with a training of COVAL staff so that they could understand what is intersectionality and how to put an intersectional intersectionality into practice. And we also had a moment to review our work and to see if we are using an intersectional approach before even we went out to do a study on the same. So later, we did a desk review analysis on economic exclusion of women in the informal settlements, and we were able to narrow down the identity factors to ethnicity, literacy level, legal status, and disability, and I'll be discussing findings around the same. So we went out, we had, we were able to interview 66 community members, and mostly they were women, on the barriers they face when they are doing business in the informal settlements. Next slide, please. So allow me to speak on the first finding, which was on discrimination on the basis of gender. And under this is that women are excluded from the financial market on the basis of gender. And land ownership is evidenced by a land title in Kenya. And title deeds are a key requirement from financial institution for you to access loans. So in that regard, only about 1% of women in Kenya own land. And what this means is that they are not able to access loans from the banks. And whereas they are able now to access loans from other microfinance institutions, they do so at disadvantaged conditions. And I'll be speaking more about on the same later. And then also we saw our research found out that women due to lack of access to clean water in the informal settlements, those who have businesses such as fruit vendors shared that women face sexual violence when they are trying to access water. We actually have a whole documentary on Sex for Water, where women are sexually exploited when they are trying to access water. And this is a barrier for them because they are not able to access this commodity, which is very essential for the running of their businesses, especially the fruit vendors. Next slide, please. We also found out that disability is a factor contributing to the economic exclusion of women. And under this, we found that women with disabilities lack the necessary level of education required to secure well-paying jobs. The level of education is low due to unavailability of special schools or the lack of inclusive regular schools within the informal settlement. Very few schools have special units in Kenya. And then we also found that women with disability shared that they are asked for sexual favors in order to secure business permits or business licenses from government officials. And this is not only for women with disabilities, but also generally for women. But women with disabilities reported this to be their biggest concern, that they are asked for sexual favors in order to secure business permits. And then women with physical disability shared that due to their mobility limitations and insecurity issues within the settlement, they cannot operate their businesses beyond 7 p.m. Yet these are the peak hours for them, but they have to get home early because there are no street lights in the informal settlement, and also the fact that they have mobility challenges. So they close their businesses at the peak hour. So you can imagine the fact that they are not able to make a lot of sales in the evening. The next slide, please. And then we had the finding on discrimination on the basis of the legal status, whereby the refugee and asylum seekers have limited opportunities for economic inclusion in Kenya. Refugee, this is because the process of refugee status determination is very lengthy in Kenya. And also the fact that there is a lot of language barrier between refugee women and the Kenyan, the public generally, and also the lack of the necessary legal documentation, and this affects their access to financial services. Also, the Somali women shared that due to cultural beliefs, men believe that they should not run businesses and they should focus on their households, and especially bringing up the children. And when they venture into the business, they are usually associated with Al-Shabaab, facing racism on top of sexism. Where I finalize, next slide, please. Also, there was discrimination on the basis of ethnic group. And this, we found that government representatives will often assist the members of their own tribe and ensure that they receive financial services, excluding the rest. Next slide. So in terms of lesson learned is that recognizing women are not a homogeneous group is key in economic empowerment of girls and women. Most women had more than 2 identity factors, which combined and interacted to create situations of discrimination, including economic exclusion. Also, another lesson learned is that intersectionality is key in identifying women most in need of and responding appropriately to their hidden needs. And finally, on the lesson learned is that participation of women with multiple identities during project design and implementation is a key requirement of intersectional practice. It enables greater program uptake and impact. On the recommendations, where I finalize is that it's not good enough to only have policies. It is important to understand the barriers faced by women women with diverse identities, and to ensure that we are responding to the specific needs. And then we must be intentional in adopting an intersectional approach in our programming. And this in greater extent means ensuring that women with multiple identities meaningfully participate in economic empowerment projects. And this, it's basically the design and also at implementation stage. And then we need to partner with local organizations that are led by women with multiple identities who understand the community-specific needs. And we must support programs that recognize the specific needs of women based on their multiple identities. Thank you.
Thank you very much, Frida. I think, you've highlighted Cobal's amazing work, looking really across the barriers that women face, what policies mean, what they actually look like in reality. And I think taking that intersectional lens, right, not only to the barriers, but to the solutions. And Nicolene, also shared in the chat in response to your prompt, some of these areas of intersectionality that you mentioned and you shared data on. So I wanted to open it up to the audience. If there are any questions, feel free to put them in the chat. You can also raise your hand and ask them, on mic and or on video. We're very happy to see you, to hear from you in any of those formats. While we're letting you kind of percolate and think about any potential questions, I can kick us off. And I will direct my first question to Hope. So Hope, when you were describing Empowered Aid's approach, can you share some of Empowered Aid's key principles when looking at effective prevention and risk mitigation strategies in relation to sexual exploitation and abuse, and any specific recommendations you have for how participants can apply these key principles in their work?
All right, thank you so much, Alina, for that question. As Empowered Aid, for us, we believe in the power of the 3 Ps. I'm going to break down this shortly. So the first important thing is really participation. It is important to talk to the women and girls, and based, for example, on the findings that I've just shared, when we were doing the contextualization workshops, we engaged the women and girls to understand the different risks that they experience or are exposed to, but also come up with recommendations. So participation, not just by having numbers on attendance lists, meaningful participation and engagement of women and girls. It's also important to share back with them what you've done with their suggestions and what is working and what is not working. For example, when we engage the women and girls in Kakuma and Adab and coach and engage them in the contextualization process, we had validation meetings with them and shared with them, okay, does this ring true in terms of the recommendations that come out? Is it a true reflection of what you wanted, shared with us to be implemented? Then we also told them, okay, this is what World Vision is going to do. When you are walking around in the distribution, look out for some of these things. So engaging them in different ways to make sure that they participate in the process of the project and how it's running and giving them feedback is very important. We continue to engage them as refugee advisory group members. The second P is share back power with them. It's important for us as aid workers to continuously reflect on how our use of power as aid workers, international or UN, regardless of the position you're in, continuously reflecting upon how you use your power. For example, what is the one thing you can personally do to share more power with women and girls that you serve? And what is the one thing that your organization can do to continue sharing power with women and girls that you serve? So it's not that we know it all as aid workers. It's important to share their power with women and girls, but also continuously to recognize them as the experts of the context within which they live. The final P that I can talk about is prevention. By applying the women and girls recommendations and expertise on how you design, implement, and monitor your programming, you can proactively identify and address some of the known risks of sexual exploitation and abuse. And this helps, stop sexual exploitation and abuse from happening before it happens, from taking place before it happens. By implementing and translating their words into action, that is one way, and it's a very core part of staying accountable to affected relations, by listening to them, but also putting their words into action. Yeah, thank you, Alina.
Thank you. And then let's see, do we have any questions coming up from the audience? I see Nicolene also shared some principles, which are great and really align with what you were saying: power dynamics, inclusivity, collaboration, and participation. Okay, so I will go ahead and take the moderator's prerogative and ask a question to Frida as well. Frida, I'm wondering, when you shared some of the coping mechanisms, let's say, or the ways that women and girls navigate these barriers, which of these do you see as potentially being able to, let's say, be supported to be brought to scale in terms of how we can support women and girls to overcome economic challenges in informal settlements? And if you have any examples of programs or initiatives that COVAL has implemented to support economic empowerment of women and girls in informal settlements.
Thank you so much, Alina, for that question. So I'm going to highlight one coping mechanism that we feel is really working. It also came out strongly in our assessment on economic exclusion of women in the informal settlement. And it's the chamas, we call them chamas, which are basically the self-help groups. So the women in the informal settlement heavily rely on the chamas, which are the self-help groups that they form within their community. And the chamas conduct table banking, which is a group-based funding system where members of a group meet at least on a monthly basis, and they make contributions to form a kitty from which members can borrow. Then each member's contributions are recorded in their passbook, and then minimum contribution can be as low as Kenyan shillings 50, and as high as the group members agree on. And the same is outlined in the group constitutions, because this self-help group or the chamas are normally registered with the social services. And it's the group itself that draft the constitution. Thus, it is set with the members' incomes in mind, especially on the minimum contribution or the maximum contribution. In most cases, the loans attract an interest of 10%. And we would say, and then those loans are repayable within a month. The interest earned increases the funds available for borrowing, and therefore other members of the chama can borrow from those savings. Chamas in Kenya have become the cornerstone when it comes to saving money for women living in the informal settlement, and they provide accessible funds to women who need it at an interest rate they can afford, and with a grace period that works for them, as since they are the ones who draft the constitutions of the chamas they belong to. So this, we have seen it to be a very good initiative in Kenya. And we have seen, for instance, other banks like Equity Bank in Kenya, they have started the Easy Chama, which allows members of the community to open and conduct joint chama activities with ease. And then all members are able to monitor group activities through these accounts, such as deposits, withdrawals, and fund transfers. Additionally, they are able to track the personal transactions in the account, such as their monthly or lifetime contributions, penalties, group statements, and other financial activities. So this is an initiative that we would really want to scale up, helping women in the informal settlement to organize themselves in chamas and ensure that they are able to save and borrow money from the chamas for their own sustainability. And then in terms of the initiatives that we have implemented as Coalition on Violence Against Women, the first one, during the COVID-19, we implemented a cash transfer program where we used an intersectional approach to identify those who would benefit from the cash transfers. And we were able to narrow down to caregivers of girls and women with intellectual disabilities. And then we gave them as a grant, a small grant, which they used to buy food and also to buy medicine for the girls and women with intellectual disabilities that they were taking care of. They also used that particular cash transfer to also boost their businesses, because most of the businesses had closed during COVID-19 period. One thing that we learned during that cash transfer initiative is that when you're working with the women in the informal settlement, it's very crucial, it's very key to ensure that on top of giving them money, you train them on how even to run their small businesses, because because of their rural literacy level, most of them, they don't have skills on financial management, entrepreneurship, business management. So it's very important to ensure that you on top of giving them the grant or the money, you capacity build them on other skills, including financial management, entrepreneurship, and business management. Thank you.
Thank you. So, clarification question from Paul Chen, who asked about one of the slides where you were talking about discrimination on the basis of gender. And you spoke to the disadvantaging conditions from mobile lenders when women try to access financial services. So it's this piece here in the middle of the slide. If you could maybe speak to what I think what Paul's asking, and Paul, correct me if I'm wrong, maybe examples of what some of these disadvantaging conditions are.
Okay, thank you so much. So in terms of the disadvantaging conditions, the first one is the grace period. So you find that, for instance, you apply for a loan today, and the repayment will start like immediately. Like for instance, when you apply for Fuliza in Kenya, the interest will start accruing immediately, starting the following day. And also for the micro finance institutions, they only give you a grace period of 1 week, and then they'll be at your door knocking to asking for their money back. So you see, that's very disadvantaging, because if you're borrowing money to go do a business, you need like a period for you to put the money into use to make profit, so that you can start repaying. So the grace period is very limited, and also the interest rates are very high. You find that in most of the institutions, the interest rates are high as 10% on a monthly basis, which is very disadvantaging for women in the informal settlement. And also the fact that they are required to like in the bank, at the bank, if you don't have like the title deeds to give as collateral, then it means that you are not able to access the financial services, which is limiting for women in the informal settlement. Thank you.
Thank you so much. Yes, we've reached our time for Q&A. So I wanted to just share a few resources with you as we're closing out. And then some of these will be contact information as well. So Paul, if you want to follow up later with Koval and learn more about their amazing work, you're able to do that. So first of all, just to say that, you know, we have a lot more information. We kept this to an hour for everyone's just availability and attention, but there's so much more that we can share. So when it comes to Empowered Aid, you're welcome to visit our website. We actually have a new website now from the one on the slide, and we'll put that in the chat, empoweredaid.gwu.edu. And we'll also we have a contact email, empoweredaid@gmail.com, that we'll put in the chat as well. And this website has all of our results reports from the initial participatory action research in Uganda and Lebanon, and from the work that we've done since then in Kenya, in Jordan, in Bangladesh, and now in Turkey, as well as policy briefs, We have all of our tools. We have an M&E toolkit with all of the data collection tools that Hope shared, and going beyond that, showing how to analyze the data, how to share the data in reports, and how to use it. And we also have a free online course that's available in 5 languages, English, Spanish, French, Arabic, and Ukrainian. Next slide. And then we also have further resources. So we've been developing a case study library, which are short case studies that show how we have been partnering with aid actors, and even other aid actors have picked up these tools and how they've used them in their context, you know, what this can look like. So that might give good ideas for your context. Also a help desk feature. If you have technical support needs, we're happy to help you. And we can go to the next slide. For COVAL, we also want to share Frida's contact details as well as the website and a link to download the full report. And we put those in the chat as well. So you can see that there's a lot of ongoing work, ongoing collaboration, and I'm sure this intersects with the work that many of you are doing as well. So as I close, I want to invite Dr. Fatuma Ali, if you want to say any closing remarks, please come on video and feel free to do so. We'd love to hear from you again. And I would like to thank, on behalf of GWI, to thank COVAL for their leadership in feminist advocacy, research, and action in Kenya and beyond. It's a pleasure to partner with them, and thank all of you for coming, for spending an hour of your time with us, and for listening. And we look forward to hopefully interacting with you in different ways as well. Okay, so if no further interventions, then we will end. We'll give you a minute of your time back. And we just really want to thank everyone. We'll share the recording and we'll share the slides as well. So you'll have all these resources in your inboxes soon. Thank you, everyone.
Thank you.
Thank you.
Thank you.
So Frida, I think you can stop the recording now.